Okay, so tonight I'll be discussing the title proposal format. So this is the format that you are going to accomplish in proposing a topic or title to me as your research advisor. So you have to fill this out. No, each of the section must be accomplished so that I would know what topic you're going to pursue and how much or how well do you know the topic that you will be pursuing. Okay. Please remember that we cannot propose a title or topic out of whim or out of the blue, naisip mo lang yung topic and then that's it na agad. So hindi po tayo nagpo-propose ng title or topic nang wala tayong nalalaman about the topic or about the phenomenon that you are going to investigate. Okay, so of course ito ay meron ng mga discussion ko or notes ko. I have sent to you a blank copy of the format, no? So first you have to just fill this out, your name, the program is MAN or yeah, Master of Arts in Nursing. Professor, that would be me, and then proposed title number. Kung this is proposed title number 1, number 2, or number 3. For example, this is just number 1, so just place here number 1, and then the proposed title. Okay? Kung ano man yung title that you are proposing. So you have to clearly indicate the title. So again, no, just a reminder that when you will be creating a title, all variables, no, all variables should be indicated in your title. What else? The target respondents or informants is also indicated. The locale can also be placed if ever. And then, if time is of the essence in your study, you can also include the time. Now, so again, the variables, the locale, the respondents, and the time. So those are some of the important components that should be part of your title. Anyway, I'll send or I'll show to you an example later. But ginagawa kasi natin yung title or fini-frame natin yung title once we have accomplished this kapag well conceptualized na yung topic ninyo. Okay? By the way, you can take down notes, no? You can jot down important or key ideas from this discussion. So the first section of the title proposal would be the reasons or the justifications in choosing the topic. Okay? So dito, indicated in this section would be your discussion. You have to discuss this section in paragraph utilizing the following. So we are following the TIOC approach. Again, we are following the TIOC approach in presenting the first section, which is your justification in choosing the topic. So when you say TIOC, ito po yung T stands for trend, I is for the issue or the gap or the identified problem, O is the objective, and then yung C, nawala lang siya, but it is the contribution. C is the contribution of your study. So meaning, all of these components must be well um, indicated in this first section, the reasons or the justifications in choosing the topic. So how do you do the first section? First paragraph, you should be discussing the trend of the variables or the phenomenon. When you say trend, what are the latest updates? What are the latest information that we have to the variables that you are going to study or to the phenomenon that you are going to investigate, both in the international and local context, meaning outside and inside no the Philippine setting. So ano ba yung mga trends natin? For example, your study is about job satisfaction and burnout among nurses. So ano ba yung trends or trend natin sa variables na job burnout and job satisfaction among nurses, both in the international and local context or national context in the Philippines? What does the literature tells us or tell us about the variables? Okay, what's the update? or how much do we know about the literature, no? So yun po. So that's the first paragraph. Um, and then the second paragraph, you should be discussing so we're done with the trend. That's the T for the TIOC. The second would be the I, which is the issue or the gap. And in the second paragraph, yun po yung i-discuss ninyo. What is the issue or what are the issues or the gaps that you have identified i- um, in your study? In the gap, you should be also you have to specify the blind spot or the blank spot of your study. When you say blind spot po, ito yung mga conflicting findings from different authors. For example, si author number one tells, for example, author one, ang kanyang findings in his or her own study is that the job burnout and job satisfaction among nurses in the Philippines is is not good, no? Meaning nurses are burnt out, nurses are dissatisfied with their work. Author number one. However, author number two indicated that nurses um, is satisfied, no, in their work, and then they are resilient in their current setting, and then probably may iba siyang findings contrary to the findings of author number one. So based on my example, author one and author two have a conflicting findings, and you can stipulate that as part of the issue or the gap that you have identified. Okay, you just have to cite who are these authors and what are their conflicting findings. So yun po yung tinatawag nating blind spot. So gagawin mo yung study mo to address the conflicting issues or conflicting findings among these two authors, two or three or more authors. So yun po yung blind spot. When you say blank spot naman, we are referring to a phenomenon. By the way, conflicting or blind spot, common to sa mga quantitative study, sa mga variables, no? Sa mga literature na meron na tayong knowledge about the variables of interest. Common to sa quantitative design. On the other hand, when you say blank spot, this is common in qualitative research. Qualitative. Meaning, kaya siya blank spot because the topic of interest or phenomenon as we know it in qualitative is somehow scarce. Okay, the topic or the phenomenon is unexplored, and here you are, a researcher, trying to provide an information about this phenomenon or topic of interest. Kaya may blank spot pa. Okay, konti pa lang yung literature that we know, konti pa lang yung nag-aaral, at ikaw as a researcher, your role is to illuminate or to explore that blank spot or to provide or to address the blank spot. Okay, kayo yung magpupuno ng kulang na impormasyon na yon. Okay, so common po siya sa mga qualitative. Okay, so in a nutshell, to summarize, second paragraph, you have to indicate here what are the issues, what are the gaps, what are the problems that you have identified in conducting your study. Why do you have to conduct the study? What are your problems? What are the issues that you have identified? So that should be well indicated in your second paragraph. Now, please remember that in your first and second paragraph, since you will be utilizing RRL literature, you have to cite your references accordingly. Dapat po tama yung ating pagkaka-cite, and we have to give credit, no, to the original authors where we get the information or the idea. So make sure that you do proper referencing or citation in accomplishing the first section, no, reasons and justification, especially the first and the second paragraph. Okay? And then yung third paragraph po, since you have already articulated your trends, the issues or the gaps, the third paragraph and the fourth, no? I mean the third and pinagsasama na natin siya actually kasi maikli lang naman. The third paragraph, you can include here the objective and the contribution. Ito na yung O and C sa TIOC approach. O is the objective and then C is the contribution in general. So what are the objectives of your study? When you say objectives, these are the goals, these are the aims of your study. And when you say contribution, what would be the benefits of your study in the society, be it in the society, um, in general or to the community in general. Okay? So ano lang po general lang kasi meron tayo dito sa second section natin yung specific. Mamaya I'll be discussing it. Pero in the first section, third paragraph, you have to indicate well po, no, specific. Ano ba yung objective? Ano ba yung gusto mong malaman in conducting your study? And what will be your contribution? So kindly indicate that well in your third paragraph. So yun po ang tinatawag natin TIOC approach. T is for the trend, I is for the issue, O is the objective, C is the contribution. And you have to articulate that well in the first section of the title proposal format, reasons or justifications in choosing the topic. Okay, so that would be the first section. Do you have any question po? May tanong po ba or clarification? May tanong po tayo or clarification?
Clear po so far, Doc.
Okay, sige. We proceed to the next section, which is the expected contribution to nursing. Okay, so here, the specific fields of nursing would be practice, education, research, and the administrators. Okay, the administrators. Okay, you have to articulate also well in the second section of the paper what would be your contribution specifically, I mean of the study specifically into the nursing practice. So dito, you have to indicate, you may specify ano ba yung nursing practice that we are referring to. A specific practice in nursing, be it in the hospital, okay, hospital man yan, or in the community, or in the industry, or in the military, or in the what else? In the school, okay? Any area of nursing practice na applicable yung study mo, please do specify. Pero kung hospital lang naman yan, hospital lang yung ilagay mo. And di ba, sa hospital, sino ba yung mga pwede maging beneficiary in the hospital? You have hospital nurses, you have the patients themselves, okay? Tapos kung may naisip pang others, then you may also include. Okay? So meaning, that should be part of the nursing practice. Itong mga hospital nurses natin, itong mga pasyente. If the nursing practice that you are referring to is the community, then you have to include you may specify na it is the community and who are these people in the community, di ba? It may be for example, the barangay health workers, the community people, or kung sino pa man yung mga significant people that might benefit in your study in that community. Okay, and other than that, sa industry, when you say industry, ito yung mga company, for example, na pinagtatrabahuhan natin. So, will it be the workers? Will it be the employers ba? Okay, so you have to specify. Okay, so how would they benefit in your study? So yun po, nursing practice. So pwede kayong maging specific, no? Na pwede nyo stipulate yung mga sinabi ko na yan, hospital nurses, or hospital patient, or pwedeng community, or pwedeng industry. Or you may be in general. For example, the nursing practice. How would the nursing practice in general might benefit in your study? Okay? Tapos, specify nyo na lang doon kung sino yung mga specific beneficiaries in the nursing practice. And the nursing administrators, you have to also indicate well how would the hospital, or I mean nursing administrators, benefit in your study. Since we are nurses here, and your program is Master of Arts in Nursing, of course, your study should revolve around the nursing practice, and also yung mga professionals, or I mean the people should include the nursing professionals. Now, as part of the nursing administrators, pwede nyong ilagay dito, how would your study benefit the leaders? Di ba they are administrators pa rin naman? So when you say nursing administrators, it the under this, you may include the leaders, policy makers. Specifically, you can include the chief nurses, the head nurses, the supervisors, no? Excuse me. Ayan, medyo kumatinilalamunan ko, ano. So yun, so meaning administrators, they are the leaders. So they are the administrators creating policy, creating rules and regulations in the hospital. So how would they benefit in your study? So kindly indicate that as well. Nursing education, of course, so dito you have to place here how would your study benefit the academe. Okay? In the academe, you may specify the clinical instructors, the professors or the faculty, and even the nursing students. Or you can go specific sa curriculum. If, for example, you are targeting to suggest a modification in the curriculum, you can also include that, okay, as part of the nursing education. And then finally, nursing research. So dito in the nursing research, you can include future researchers. How would your study benefit the future researchers, our colleagues na nurse researchers? Okay? So yan po, you have to accomplish this specifying the expected contributions of your study to these areas or these fields of nursing. Okay, so far, are we still good? Are you still with me? Nakuha po or clarification? Baka meron. Sige. Seeing thumbs up and hearing none, I will proceed. Sige. Before ko i-touch itong instrument or questionnaire that you will be using, dito muna tayo sa conceptual model, no? Sige, conceptual model po muna tayo. Okay, for the conceptual model, you will be presenting your conceptual model using the IVDV diagram for quantitative. When you say IVDV, independent variable for quantitative. And then IPO format for qualitative research. Okay, so dito muna tayo sa IVDV for quanti. So this is an example of a non-experimental correlational design showing the IVDV diagram. So, excuse me, when you say IV, it means independent variable. DV is dependent variable. If the study is all about, bigyan ko na, for example, ng context itong study, itong example natin. The influence of job burnout, and workplace environment among workplace environment on job satisfaction among hospital nurses in Bulacan. Okay. So I'm not saying that this is the title, but somehow, no. Kumbaga, this is the context of the study. The influence, you would want to know the influence of job burnout and workplace environment on job satisfaction among hospital nurses in Bulacan. Okay. So my variables here would be job burnout, which I indicated here. Nalagyan ko lang ng kulay, but it doesn't matter. So job burnout is the independent variable, one of my independent variables. Another independent variable would be the workplace environment. And then finally, the dependent variable is job satisfaction. Okay, so I have three variables, and if that's the case, I have to indicate that dapat well indicated yan sa aking IVDV diagram. If I have 4, if I have 5, dapat kita yan sa IVDV diagram ko kung ano-ano yung mga variables na yan. Okay? Kung dalawa lang yan, then remove yung tanggalin mo lang yung isa and then yung dalawa lang ilagay mo. Pero kung tatlo yan, then you have to include all. Okay? And then you have to know what is your what are your IVs and what is the DV. Dapat well articulate and you know that well dapat as a researcher. You know what will be the IV, you know what will be the DV. Though in a in a correlational non-experimental, it doesn't matter kung ano yung IV and DV kasi it's just correlational eh. You are not after the cause and effect. You're just after the association between the variables, no? But you somehow you should know pa rin what will be the direction of your study kasi even though it's correlational. Okay? So yan po. So in this case, I have two independent variables and one dependent variable. This is non-experimental. This is correlational. Okay? By the way, may meaning yung line, solid line na to. I do not use arrowhead pointing to the job satisfaction kasi this is correlational lang naman and not experimental. Kasi if it's experimental, I will be using an arrowhead pointing towards job satisfaction. Pero since correlational lang siya, ano lang yan, solid line. Ganun din si workplace environment. Okay? Solid line na nakadikit kay job satisfaction. Okay? So yon. So I would want to know the association or the influence of job burnout to job satisfaction. Ganun din yung association or influence ng workplace environment to job satisfaction. And then if it's experimental, ayan, so pwede na akong mag-arrowhead dito. I can use arrowhead since this is experimental. Okay, so we are after cause and effect. For example, my study, for example lang the study is an experimental study and it's all about, ayun yung dumiretso, it's all about kasi one example that we have conducted in the past was the the effect of light therapy. Okay? Effect of light, blue light, no? The effect of blue light um, therapy or treatment in decreasing blood pressure. May ganun po yun. So this is just, kumbaga, a simple representation of the experiment or the design of the study. Pero it can still be presented well. Kumbaga, nilagay ko lang dito as part of the example. Just to show what are the variables. In this case, blue light is one of the variable and it has it causes an increase or decrease in blood pressure kasi. Tsaka experimental to kaya may arrowhead. Okay? Pero this is not the exact um figure for the experimental. Pwede pa yung mas mapa tawag dito comprehensive, no? But our focus is ito lang muna since I know some of you ay correlational. So pwede kayong mag IVDV diagram. Okay? So yan po, that is for quantitative. For experimental, this can be kumbaga a hint sa inyo pero this can still be improved, no? And then for qualitative, so again, for quantity, that's IVDV diagram. And then for qualitative, so it can you can use we do not use IVDV diagram. Instead, we use the IPO model. Okay, the input process output, no? So ayan po. You just have to include here the input would be your pwedeng yung inyong central question or your statement of purpose, no? Yung inyong central question or the grantor question. And then yung process, this is how you are going to collect data. This is how you are going to analyze data and the other processes, no? And then the output, what would be the expected output of your study? Okay? Will it be a program? Will it be so kadalasan pag qualitative, ang output niyan ay um, thematic tree or conceptual framework, no? Na magagawa ninyo. So that can be an output. Okay. And then this one is also another example of an IPO model. This one's very simple. Okay, so the input is the live experiences of the aged people in a home care. The process is perception about the end of life, and then the output is the eidetic model on end of life. And then just a short explanation of what the figure is all about. Pero kahit wala pa muna explanation, no? I just need to see the IPO for the conceptual model. Okay? So ito po ay for qualitative. Okay? Ngayon, may mga quantitative na pwede ka rin mag-IPO. Okay? Pero let's stick to the guidelines na lang. Okay? Pag quantitative IVDV diagram ka na. Pag qualitative ang study mo, mag-IPO ka. Okay? Para alam natin, pag quanti, what are your variables? Kapag quali, ano ba yung gagawin mong, what are your inputs, what are your processes, and then the outputs. So that is a conceptual model. May tanong po, are we still clear so far?
So far, okay po, Doc.
Okay, sige, tuloy tayo. So, sige, bago ako magpunta sa questionnaire, ano, punta na tayo dito sa SOP. Okay, statement of the problem for quanti, and your SOP should be based on your conceptual model. Dapat align po ang SOP and the conceptual model. Pag quanti, statement of the problem. Pag quali, statement of purpose. Okay? Pag quali, statement of purpose ang tawag. Pero pag quanti, statement of the problem. Sa ibang university, they use aim of the study for qualitative. Pero siguro, for now, we use statement of purpose for quali. Statement of the problem for quanti. Okay, so how do you now frame your SOP? Okay, so you have to start with the general aim of your study. So ito, ginawa ko na siya based on the conceptual model. So kunin ko lang yung conceptual model natin dito sa taas para makita how it was framed. Okay, so ayan, tignan. First, the general aim. You have to stipulate the general aim of your study. So you may start by saying the study aims to determine the job burnout. Ito yon. In your IVDV diagram, work environment, ito yon. And job satisfaction, ito yon. Of hospital nurses, dapat in your general aim, nakastipulate who are the respondents. And in this example, hospital nurses, also stipulated the locale of the study, and in this example, Bulacan, Philippines. And then what are your other aim? That is to identify the relationship between the variables. Okay, so ito yon yung line. Okay, the association. Okay, so yun po yung general aim of this study. To determine the job burnout, work environment, and job satisfaction of hospital nurses in Bulacan, Philippines, and identify the relationship between the variables. So that was the general aim of the study. Now, specifically, it seeks to answer the following question. 6 answers to the following questions. So, okay, so how do we now frame the specific questions based or aligned sa ating conceptual model? So as you can see here, we have 3 variables. So you will start with each variable in framing your question. If the first variable, we'll start with the independent variable. So the first IV is job burnout. So your meaning the first specific question should be about job burnout. So how do we frame the question? So yung framing ng question, it will depend on your questionnaire. If the questionnaire na nakita or nagawa ninyo is trying to determine the level of job burnout among nurses, then you can use the term level. Otherwise, you have to use terms that is aligned and appropriate to the questionnaire. Okay? Kaya again, dapat clear na sa atin kung ano yung questionnaire or survey tool or instrument na gagamitin ninyo so that proper na yung pagkaka-phrase ninyo or wordings ng inyong SOP. Okay? In this case, ang ginamit ay level because the questionnaire will measure the level of job burnout among hospital nurses. So the first specific question is the first variable, job burnout. And it was framed as what is the level of job burnout among hospital nurses. Okay, so that's the first SOP, specific question for the first variable. Second would be, ito po yon, yung second independent variable natin, which is workplace environment. So how do we frame the question? How may the workplace environment of the nurses be described in terms of leadership and management, organizational commitment, relational commitment? Now, you might be wondering, saan ko nakuha yung leadership and management, organizational commitment, relational commitment? Nakuha ko po ito sa, for example lang, sa questionnaire or survey tool or instrument na gagamitin ko or nagawa ko. If you will measure workplace environment using these sub-variables, dapat naka-indicate yan. Okay? So dapat in our IVDV diagram, nakalagay rin po rito yon. Yung 2.1, meaning yung leadership and management, dapat nakalagay dyan as sub-variable. Leadership and management, organizational commitment, etc. Relational commitment. Okay, nakalagay dapat dyan. Pero again, malalagay mo lang yung mga yan well, if alam mo na kung ano yung instrument na gagamitin mo. Otherwise, hindi mo pa mailalagay yan. Okay? So, assuming na, for example, alam ko na, so, yan, mailalagay ko siya. Okay? So, kung SOP number 2 yan, so 2.1 dapat, 2.2, 2.3. Pero kung wala namang ganito, walang sub-variables, leadership and management, organizational commitment, relational commitment, tanggalin yan. No? So no need to place that. So pwedeng how may the workplace environment of the nurses be described na lang. Okay? Ganyan na lang siya. Pero if your questionnaire talagang would measure those sub-variables, so dapat well indicated po yan. Okay? So yan, kaya sabi ko, kaya dito in the first section, dito sa taas, meron ng stipulation about the instrument kasi dapat alam na natin what will be your plan for your instrument. Mamaya we'll go into that. So that's the second SOP or specific question about workplace environment. Third SOP is about job satisfaction. So nakita niyo po, we have one SOP per each variable. So one for the job burnout, number two for the workplace environment, number three for the job satisfaction. So one SOP for each variable. So dito, job satisfaction, for example, ang gagamitin kong questionnaire ay about level. I will be measuring the level of job satisfaction. So I can frame the question would ask ganito, what is the level of job satisfaction among hospital nurses? As simple as that. Pero kung again, meron pa uling sub-variables akong sa instrument or questionnaire na gagamitin ko, may mga sub-variables pa yan. Okay, halimbawa, ano ba yung sa job satisfaction? Halimbawa, salary. Halimbawa, another one, 3.2 would be peer. Kung may ganyan, that would measure the job satisfaction sa instrument mo, kailangan naka-indicate yan. Okay? Pero kung wala, again, tatanggalin nyo po yan, ha? Hindi na kailangan yan. Pero assuming na wala, so tanggalin na lang natin siya. Okay, so we have now, so okay na tayo, we have now 3 SOP or 3 specific question for each variable. Ang next natin, this is just quantitative correlational, ha? Number 4 SOP is itong line. Okay, itong line na nagdudugtong sa dalawang variables where we will be testing the hypothesis no mamaya. So dito, as you could see, job burnout and job satisfaction. So meaning, your SOP number 4 should be about the relationship na between job burnout and job satisfaction. Ito po siya. So is there a significant relationship between job burnout and job satisfaction? So ito yung line na nagko-connect sa dalawa. Kaya sabi ko, um, yung figure na yan may ibig sabihin, yung lines na yan na nagko-connecta sa dalawang variables. At eto yan, no? Sa SOP natin. Ngayon, puwedeng significant relationship lang 'yan, puwede ding significant difference, kayo pong bahala. Magkaibang statistics or statistical analysis yung ginagamit do'n, pero depending on the goal of your study, you may change the relationship into significant difference, depending on your study. For this example, assuming relationship lang tayo, so 'yan na muna 'yun, okay? And then the next SOP, number 5, is the relationship. Ito namang line na 'to, okay? The relationship between workplace environment and job satisfaction. So that's the number 5. So as you could see po, this is what we say the alignment between the conceptual model and your SOP. Okay? So seeing the IVDV diagram pa lang, alam ko na kung ano yung mafe-frame kong SOP, alam ko na kung ano magiging direction of my study. Kumbaga, isa rin sa una kong tinitignan when I check a paper is the conceptual model, is the conceptual framework of the study. Kung ano ba yung mga variables and ano ba yung figure na yan. Okay, the relationship or yeah, the framework how the study is framed or the variables are created. So SOP 1 about job burnout. SOP number 2 about workplace environment. SOP number 3 about job satisfaction. SOP number 4 about the relationship between job burnout and job satisfaction. SOP number 5, relationship between workplace environment and job satisfaction. So ito po yan lahat. Okay? And then finally, of course, after knowing all, nalaman mo na yung job burnout, nalaman mo na yung workplace environment, job satisfaction, yung relationship between the variables, what's next? Hindi pwedeng masters na to, hindi pwedeng malaman lang natin sila nang wala tayong gagawin. Of course, based on the findings, ngayon, kayo po yung maglalagay ng appropriate sa study nyo. Kung ano yung tingin yung um, pwede nyo ma-create out of your findings, feel free to include that. So based on the findings, what program ba yan? Interventions ba yan? Policies ba yan? Strategies ba yan? Or any other na naisip nyo that you can formulate, feel free to include that as part of the SOP. Okay? Yung last SOP po natin, ito yung output of your research. Okay? Again, your last SOP should be about the output. After knowing all your results or the findings, what will be the output of your study? Okay? And that should be part of the SOP. So yan po. So that's the alignment of our SOP with our conceptual model. So yan po So ngayon alam niyo na, sa tingin pa lang, titingnan niyo pa lang yung IVDV diagram for quantitative research, alam niyo na kung ano yung SOP na pwede ninyong ma-graph out of your model. So that is for quantitative correlational. Now, for qualitative, ito ay sample lamang. No, I'm not saying that this sample is perfect, but this should give you a hint, no? This is for qualitative sample. So iba yung quanti. Pag quanti, this is the structure. For quali, ito naman po yung structure, no? For qualitative. We call that statement of purpose. So you can frame your question as, this research aimed to determine the lived experiences from the lens of aged people. residing in a home care facility about death and dying using phenomenological study. Tapos wala na 'to ano, sorry, wala na 'tong specific question na 'to. Ayan, so hindi ko na siya matanggal. So yon statement of purpose, so yun lang siya. Tapos central question ang mahalaga dito actually. Sige, tanggalin ko na 'to. So central question lang ang mahalaga dito for qualitative, 'no? So you have the aim of the study, tapos ilalagay yung central question. Isa lang 'yan, 'no? Central question. So in this example, the central question was how the key informants understand the end of life, death, and dying from the lived experiences of aged people. Tapos, if you have any probing questions that would support the central question, nilalagay lang natin dito. Okay? This is for qualitative research. Again, for qualitative, ang pinakamahalaga ay yung central question. This is the overarching question na tinatawag. And then, yung mga probing questions, these are just supplement, no, that would support the central question. Yung probing question, it revolves pa rin naman sa central question. No, the probing questions will help illuminate yung ating pinaka-central question. Okay, so this is how you frame your qualitative research sample. Okay, sige. Ayan, sige, Sir Paul, you may speak po.
Yes, Doc. Regarding po sa ano sa qualitative research, sa quali, IPO po dapat siya, 'di ba? Yung ano, yung conceptual framework.
Yes, yes.
Pwede bang mag-IPO sa quanti? Hindi pwede.
Yes, sir. Sabi ko pwede naman, pwedeng mag-IPO sa quanti.
Opo.
Ginagamit din actually natin siya. Pero sabi ko nga, just for us to be clear of what your variables are for quantitative, we stick with the IVDV diagram. For our, no, for our case na title proposal.
Sige po.
Pero if it's not, if you think na it's not or it's more feasible for you, no, even though it's quanti na mag-IPO, pwede naman. Basta clear lang sa akin what are your variables. Gusto mong mag-IPO and it's quantitative correlational, pwede naman. Basta as long as clear sa'yo what are the variables. Okay?
Noted po, Doc. Thank you. Thank you po.
Sige. So yun, qualitative, ito po yung framing ng ating SOP. So again, yung conceptual model dito is IPO. For statement of the problem, so this is how we frame the SOP for the quanti. You may use IVDV diagram here. Okay? That's based on our discussion. So clear na tayo for the conceptual model and the SOP for both quanti and quali. We now proceed to the instrument or questionnaire that you will be using. Ito yung nasa taas pa at ngayon ko lang siya di-discuss. By the way, baka may question pa po or clarification about what I have discussed.
So far sa akin, Doc, okay na po.
Sige. Ma'am ECJ, kayo po.
Clear po, Doc.
Okay, sige. Tuloy tayo, no? So this is, I think, the last section. Yeah. For this template. So this is now the instrument or questionnaire, no? For quantitative, ayan, sige. For quantitative, this is for quantitative. For leave it blank for qualitative research. Okay? So ito ni-discuss ko ay applicable for quantitative. Okay? Itong section na to, if your study is qualitative, you leave it blank. Wala po kayong ilalagay muna. Kasi for qualitative, ang tawag natin ay interview guide question. And you can just formulate your interview guide question at the end of on the latter part. Okay? Tsaka gagawa naman kasi kayo ng probing question for qualitative. Okay, so andito yon. Kaya dito sa questionnaire, kahit wala na muna yung mga specific interview guide questions that you will be asking. Okay? So this one applies for quantitative research. Okay? For quanti lang po ito. Okay, so dito for quantitative, meron tayong three types na pwede niyong gamitin. For your, by the way, instrument, questionnaire, survey tool, pare-pareho lang po yan. I am referring to the same concept, no? Instrument, questionnaire, survey tool, kung ano pa man yung tawag niyo dyan. Okay, so yan. So, pwedeng adopted na letter O, adopted na letter A, or pwedeng researcher made, or tawag nila, yung iba ang tawag self-made, or pwedeng researcher made questionnaire. Sige, dito muna tayo sa adopted na letter O. When you say adopted na letter O, okay, meron kayong halimbawa, your study for example is, yun na nga, job burnout, job satisfaction. And in when you browse the literature, may nakita kayong instruments na align to your study. Meaning, job burnout tool, job satisfaction tool na align to your study na pwede mong i-adapt. When you say adapt, letter O, you will use the questionnaire as it is. You will not modify, meaning there will be zero modification. Kaya letter O, zero modification. Kasi align na align yung instrument sa study mo. Wala ka nang kailangang baguhin. So pag may nakita ka, well and good, no? Ano gagawin mo na lang? You just have to ask permission to the author. Kasi usually sa journal, may mga email address doon yung authors. You just have to email them asking permission that they will be utilizing the instrument or the questionnaire in your study. So ano lang, anong gagawin mo? You ask permission and dapat ma-obtain mo yung full question. Okay? Meaning lahat ng questions in that instrument, kung may 20 or 30 or 40 items, yung questionnaire na yon, dapat makuha mo. You can ask the questions to the authors, no? Kung nagre-reply sila. Pero you can also obtain the full questions in reading journal. Sometimes kasi sa journal, makikita mo na at the latter part, as part of the appendix, no? Yung appendices, makikita mo na doon yung mga questions, yung lahat ng questions na ginamit in that research. Kung available yun, then you are lucky. Pero kung wala, you have to obtain the full question to the author kung magre-reply sa'yo. Now, in asking permission, mahalaga na email mo. Kung hindi man sila mag-reply, at least na email mo. Pero some authors, nagre-reply talaga sila. Marami na kami na-encounter na ganyan. That they are responding at talagang binibigay nila yung questionnaire, yung full questionnaire and how to do the scoring. Kasi if you also know how to to score the instrument or the tool that you will be utilizing. Though it's part of the statistics or the statistician, pero you have to know the details kung paano yung scoring ng job satisfaction or ng job burnout. And some authors, they are very accommodating. Pati iyon sinesend nila. Pero kung walang ganon in your case, you have to find your own ways. You have to find those details. Okay? Aside from that, you need to determine the validity and reliability score. Kasi when you are going to adopt na letter O, we mean na these questionnaires or this tool, ito yung tinatawag nating standardized. So ito po yung mga standardized questionnaire. And when we say standardized, validated na yung questionnaire na yan and they are reliable. And if they are reliable and validated, meron tayong validity and reliability scores na tinatawag. At mababasa nyo po yan, makukuha nyo yan sa mga journals or in reading or literature. Readily available po yan. Pagka may nakita kayo, halimbawa, job burnout. Halimbawa, ito po. Ito yung mga Cronbach's Alpha na halimbawa 0.89, a reliability score of 0.78, yung mga point something na yan, close to 1, yan po yung mga Cronbach's Alpha. It's always point something. No, pero it will not be a whole number. O halimbawa, your first variable is job burnout and there are 20 questions. Dapat in 20 questions na yun makuha mo. And how do you stipulate or how do you ito po yung kung paano gawin yung yung questionnaire. Eto po ilalagay niyo lang diyan, job burnout tapos ilalagay niyo kung ilan yung questions. Tapos ilalagay niyo yung details of the instrument or the questionnaire. And for example, according to the study of Manaloto 2023, for example, this is the journal or the author where I get the information, ilalagay niya lang, it has a reliability score of 0.78. And in the study of Martinez, the Cronbach's alpha, ito yung sinasabi natin is 0.89. Okay? So that's how you're going to um, indicate po your questionnaire. Okay? Para alam ko or you know what will be the direction of your study. Okay? And then for example, for work environment, dapat po bawat variables meron na nito. For work environment, may nakita kang 15 I mean, the name of the questionnaire dapat nakalagay diyan ano. Halimbawa, work environment questionnaire or work environment scale. Atong job burnout um, short form, for example, yan yung pangalan ng questionnaire. So ayan siya. Job satisfaction tool, ayan. Ayan yung kanyang name, for example. So, ganun pa rin. So, the title of the questionnaire, where alam mo na na ito yung variable mo na work environment. And the questionnaire na nakita mo or i-adapt mo has 15 questions. So, ilalagay mo pa rin yung validity and reliability score. Halimbawa, according to De La Cruz 2020, the validity score of work environment scale is 0.72. Tapos yung job satisfaction tool naman was it is 10 questions developed by, for example, developed by Miranda 2020, and in the study of um, halimbawa Martinez, the reliability score of job satisfaction tool is uh, 0.83, for example. Okay? So yun po. If you could also place the name of the original author, please do so. Okay? Kung sino yung pinaka-original author. So again, where you will get the details of this sa mga journal. Sa extensive reading nyo ng RRL, may mababasa po kayo. So that's their own adapted. So next one would be adapted na letter A. So in this example, or in this questionnaire, may nakita kayong questionnaire, kaya lang meron kayong imo-modify. Meron kayong kailangan tanggalin na questions or meron kayong kailangang idagdag na question. Okay? Pero you will be utilizing, halimbawa, job burnout short form. Ito yung nakita nyo, your study is about job burnout, pero tingin nyo ay may tatanggalin kayo, may ibahin kayo. So you will be modifying. Okay? If that is the case, you will modify the instrument or the tool. Still, you have to ask permission sa author, sa original author. Mag-email uli kayo. And then, when you email the author, again, kailangan pa rin kuhanin nyo yung mga details na diniscuss ko rito sa taas. Okay? Yung validity reliability test, yung full question, kailangan alam nyo. Tapos, para alam nyo kung ano yung modify ninyo, ano yung tatanggalin nyo, ano yung dadagdag nyo. Okay? And then, aside from that, um, i-modify nyo siya, di ba? So, when you have recreated the instrument, you will subject it for validation. Subject for validation. Wherein you will be seeking the advice from the expert, and then you will get approval from the expert. Okay? So again, meron kayo sa letter A na adapted, may nakitang instrument or tool pero imo-modify nyo. Okay? Since imo-modify nyo siya, you have to ask permission to the author na gagamitin nyo yung instrument pero imo-modify nyo. And then you need to get the full questions para alam nyo yung tatanggalin, yung idadagdag, and you have to know also the reliability and reliability score. No? Just for you to know how reliable it is. Okay, and then once na alam niyo na yung mga details na 'to, you have to recreate the instrument, i-tailor fit niyo na sa study niyo, magtanggal na kayo, magdagdag na kayo. Once na-edit niyo na siya, you will now subject the recreated instrument for validation. Okay, papa-validate niyo na yung instrument na nagawa niyo sa experts. So, usually sa masters, tatlong expert, no? And even sa undergrad, tatlong expert. And these experts should be really experts. Usually, ito yung mga may PhD, ito yung mga may mataas na degrees na and experts in the field talaga. Okay? And mahalaga yung kanilang credential, no, sa pagpapa-validate. Hindi dapat kung sino-sino lang. So that you can get their advice. And then, i-check nila yung instrument, tapos magbibigay sila ng comments and recommendations. You will follow the comments and recommendations. Pag approve na sa kanila, then pwede mo nang gamitin yung instrument. Okay? So that is just validation. Pwede ka rin magpa-reliability, pero ibang process yon. Okay? So, pero ibang process yon, and your statistician can guide you onto that. Okay? Ito yung mga may pilot testing, tapos meron tayong alpha. Ito rin yon, yung reliability score na tinatawag. Okay? If you do the pilot testing for that instrument. Okay? Pero what I'm saying here is yung validation from the experts. Okay? So iba pa yung sa reliability score. So ang usually naman kasi face validation, or I mean content validation. Content and face validation from experts yung ginagamit natin. Pero pwede rin kayo magpa reliability score. I mean reliability test. Okay? So that is for the adapted. Okay? So medyo mas mahirap siya compared to adapted na letter O. Kasi pero depende kasi yan sa makikita nyo nga. Pagka may nakita kayo pero hindi naman talaga tailor fit or hindi naman talaga akma, no? Ay kailangan niyang baguhin, ito yung magde-letter A talaga kayo. Ngayon, yung pinaka last option would be the researcher made questionnaire. Kung wala talagang instrument or tool or questionnaire or instrument na available in the literature that would measure your variable, or kung meron naman available, kaya lang ayaw niyong gamitin. Ayaw niyong mag-adapt. Okay? Ayaw niyong mag-refer to other authors. Pwede kayong gumawa ng sarili niyong question. Okay? So, how do we do that? You create your own questions that would measure the variable. Ang challenge lang dito is that yung maki-create yung mga questionnaire is, would that really measure the variable? For example, your variable is job burnout, job satisfaction. Yung bawat question ba na yon would really measure the job satisfaction or the job burnout of of the respondents. Okay? So you have to create your questions. After creating your questions, maghahanap ka uli ng pwedeng uli yan content validation or reliability test, no? So, kung validation yan, hanap ka uli ng expert that would validate your questionnaire, tatlo sila, and then i-submit to them your questionnaire. They will give their feedbacks and recommendation. You will follow them until you get their approval. Okay? So may cost, no? May cost po yung pagpapanel or yung pagpapa-validate natin sa expert. And also, yung reliability test, okay, may cost din yan sa statistician. Okay? Para mapa-validate or mapa-reliability test ninyo yung study nyo. Okay? So, ayan. If you will be asking me, ano po sa tatlo yung mas madali? Or I mean, mas less hassle kumbaga. Kung meron namang available na instrument that would measure the variable, mag-adapt ka na ng letter O. As long as, ang hinahanap ng panel, ganito, no? Kapag adapt na letter O, dapat yung questionnaire na yan, nagamit somehow in the Philippines. If our context is in the Philippines. Kung nag-originate yung questionnaire mo sa abroad, at dapat somehow may mabasa kang literature na nagamit na yan sa Philippines. Kung wala sa Philippines, at least in the Asian country. Okay? Para at least ma-resolve or ma-address yung cultural cultural issues, no, in creating questionnaire. Kasi may cultural aspect tayong tinitignan kapag questionnaire. Okay, at least nagamit man lang in Asian country, pero kung in the Philippines, mas better. Okay? The key here is to really just read literature. You have to read and read hanggang may makita kang questionnaire that you can adapt na letter O. Again, you can adapt na letter O as long as related to your study, relevant, at talagang align. No? Pero kung walang-wala talagang makita, I would suggest na mag-researcher-made questionnaire ka na lang. Kasi gano'n din naman eh, kung letter A, magpapa-validate ka sa expert, okay? So almost the same, eh, kapag adapted na letter A, magpapaalam ka pa sa original authors, di ba? So double the the problem kapag ka gano'n. Kaya dito ka na lang sa researcher-made questionnaire kung wala kang makita. Okay? Pero usually, sa mga na-encounter ko sa masters, adapted na letter O. Sa mga undergrad, since they are, marami sila and they have, kumbaga, they have resources, nagre-researcher made questionnaire sila. Pero kayo pong baala. Kayo naman yung masusunod dyan. As long as align sa study po natin. Okay, so ayan po. Sa undergraduate, tatlong titles yung pinapagawa ko. Meaning tatlong papers na ganito. By the way, yung last section pala, the references, no? You have to list down all the related literature and related studies that you have consulted. So sa undergraduate, at least, um, initially at least 20, tama ba? At least 20 or at least 10, sorry, at least 10 for the undergrad. Since this is just title proposal for the undergrad, at least 10. Sa inyo rin po sa masters, siguro at least 10 muna. At least nasa title defense or title proposal pa lang naman tayo. So ayan po, question po muna about the instrument or about the section of your title proposal template na gagamitin.